In the words of Ina Mae Gaskin, a certified professional midwife and founder of the Farm Midwifery Center, when we as a society begin to value our mothers as the givers and supporters of life, we will see a social change in ways that matter. Women all over the United States are dying of what's called maternal mortality. Now you might ask yourself, why should I care about this? I identify as a man, or I don't plan on having children in the future. Well, maternal mortality can affect any woman who is capable of giving birth. It could be your mom, your sister, your niece, or even a female best friend. As the daughter of a seasoned certified nurse midwife and someone who plans to have a career in midwifery, I have familiarized myself with the risks pregnant women face. Also, as a woman who one day plans to have children of her own, I have frequently researched the topic in hopes that I would have knowledge of my own maternal health. The maternal mortality rate in the United States is high. In order to understand maternal mortality, we must first go over the maternal mortality rate in the United States, the causes of maternal mortality, and the steps being taken to reduce maternal mortality in the United States. Let's get into maternal mortality rate in the United States. So you might ask, what is maternal mortality? According to the World Health Organization website, maternal mortality is the death of a woman while pregnant or within 42 days of termination of pregnancy. While maternal mortality is going down in developing countries, it's on the rise in the United States. According to Nan Triano and Patricia Witcher, directors of Women's, Infants, and Critical Care Obstetrics, while maternal mortality rate is gone down 48% in developed countries and 44% worldwide, it is more than doubled in the United States. From 12 per 100,000 births in 1990 to 28 per 100,000 births in 2013. Now that we've talked about the maternal mortality rate in the United States, let's talk about the causes of maternal mortality rate. The top 3 causes of maternal mortality rate are hypertension, medical intervention, and infection. The most common cause of maternal mortality is hypertension, also known as high blood pressure. With hypertension comes risk to the mother's systems and organs, which in turn leads to risk to the baby. According to Triano and Witcher, hypertensive disorders were the leading cause of pregnancy-related deaths among 39.5% and 48.9% of women. Another cause of maternal mortality is medical intervention, such as cesarean sections. A cesarean section is a surgical procedure in which the woman's uterus is cut to deliver a baby. With this surgical procedure, many complications can follow. According to Ina Mae Gaskin, these complications from bowel obstruction months following the surgery, deaths from infection, and from hemorrhaging following the cesarean section, whether from nicks to the uterine artery or hemorrhaging during or following the surgery, lead to maternal death. Finally, as previously stated, cesarean sections lead to a higher and or increased risk of infection. Triano and Witcher state infection has remained the second or third leading causes of pregnancy-related death from 1987 to 2013. Infection further compromises the mother's system, which in turn leads to more complications and or death. Now that we've talked about the causes of maternal mortality, let's get into the steps being taken to reduce maternal mortality in the United States. The most progressive steps being taken to reduce maternal mortality in the United States are improvement of maternal health and hyper-awareness of maternal complications. Dahlia Sofer, a Whiting Writer Award winner, states, California has been the only state to show reduction in maternal mortality. They have created a series of maternal safety bundles to cover essential aspects of care for pregnancy and childbirth. Due to these bundles, medical professionals are able to focus on treating preventable causes of maternal mortality. Another progressive step to reducing maternal mortality is hyper-awareness of maternal complications, such as obstetric hemorrhaging, hypertension, and infection. Kathleen Simpson, a prenatal clinical nurse specialist, states that maternal mortality is reduced with key aspects of readiness recognition and prevention, response and reporting systems learning, and focus on giving the best care to every woman in any setting whenever an event occurs. In conclusion, you should have a better understanding of what maternal mortality consists of. Following our discussion of maternal mortality in the United States, the causes of maternal mortality, and the steps being taken to reduce maternal mortality in the United States, I hope you have a better understanding of maternal mortality. As proclaimed by the American feminist writer Jessica Valenti, the U.S. spends more than any other country on maternal health care, yet risk of dying or coming close to death during pregnancy or in childbirth remains unreasonably high. Thank you. And then show yourself.